Well, thank you so much for attending. And I do a lot of research in the space, and I do a lot of, translating that research to action. So what I'm going to do, I'm going to try to stick as close to 15 minutes as I can. I'm going to just talk about some new research coming out, actually published tomorrow, and then strategies that my team, my collaborators, and I use to advance action. And then hopefully we'll have a healthy Q&A. So without further ado, I'm going to just get started. And this slide deck is a little bit longer than 15 minutes, so there might be slides I rush through, but we can always address those in the Q&A. So generally, the topic is advancing environmental beauty justice through solutions-oriented research. And I'm just going to try to, okay, well, I don't really have a timer easily available to me, but that's okay. Right, okay, so one, right, I think you're probably on this call because you have some idea that personal care products and beauty products being one subcategory of that contain multiple chemicals that can harm health. And we're concerned because some of these can, interact with hormones or are endocrine disruptors. Others are allergens, right? So allergies are growing in this country and can be a big quality of life issue. And also others are cancer promoting agents. So these are from the BCPP, Safer Black Beauty source, which is a great resource. And these are just three chemicals, that we're concerned about. Fragrance being a mixture of chemicals, and the problem with fragrance is often because of trade secrets. It's hard to know what are the actual components of the fragrance. I've been doing this research now, lo and behold, for 15 years, and the kind of health effects evidence has really developed during that time. So, we know that there are these chemicals. There's very few regulations of kind of around kind of chemicals in personal care products at the federal level. And we know that, that's a source of how they get into our body. But then the evidence is developing around health effects, especially those, around hormonally driven health effects, across a life course. So associations with earlier age at menarche, pregnancy complications, uterine fibroids during midlife, as well as a host of cancers, particularly in postmenopausal women, especially with breast cancer. The other thing that my research and others have pointed out is that not all populations are equally exposed. So we have really, there's mounting evidence that Black and Latinx populations use more toxic products across multiple categories, including hair, skin lightening creams, cosmetics, fragrance products, and vaginal deodorants. And that, these sources of the products, these products themselves become, sources of the chemicals that are measured in our body, right? So there's an association between kind of the frequency of use of certain products and greater exposure to phthalates or parabens in our bodies. And we also know that Black and Latinx populations have higher exposures to certain endocrine disrupting chemicals than other populations. And I would argue, this is, often we think about or personal care product use is framed as an individual choice. And of course, there is a lot of, there is a component of individual behavior, but it's not entirely, an issue that is, I think about personal responsibility because really beauty is very socially defined. Beauty is one of the oldest forms of gendered power. So what we find beautiful is socially constructed. There are racialized beauty norms, with Eurocentric beauty norms grounded in white femininity at the top of the global hierarchy. This is a global phenomenon. And simply put, the closer you are to those ideal beauty norms, whether it's with straight hair or light skin, the more social and economic benefits you may have, whether it's greater marriaging potential in certain countries or greater likelihood to get a certain job. And so one adaptive response is using certain products like chemical hair straighteners or skin lighteners, which, can result in chemical exposures, which can impact health and disease across the life course. So this is something we call the environmental injustice of beauty. Um, and over the years, we have developed a research agenda, right, around, well, how do we dismantle this? And there's everything from doing educational interventions to kind of help shape individual behavior, all the way to trying to inform policy, to addressing the social norms, which are really the elephant in the room, but are much harder to change. And the pace of change on that is years to decades. So I just want to briefly talk about one community-based study that we have been doing now for several years, focused on South LA, which is an environmental justice community in Southern California. This work is led by Black Women for Wellness, a reproductive justice organization, and Occidental College, Columbia, Silent Spring Institute, and LA Grit Media are other partners. And so basically, phase one was more of a discovery phase to understand beauty product usage and chemicals of concern among Black and Latina women in South LA. And then the second phase is intervention study, which is still ongoing. So I'm just going to present what findings from actually a paper that will come out tomorrow. So we're getting some interest from reporters. So you might see it in the news too. So one thing we did was, often when you do these kind of studies, we rely on people recalling the products that they use, and they might just say, "Oh, I used a lotion," or "I used, fragrance hand soap." But there's actually, one, recall isn't that accurate, and then there's a lot of variability between lotions, for example. So we did something different in our community engaged study. We developed an app that was available in English and Spanish, and we had participants log every product they used for the span of 5 days. And then using something called OCR, we were able to scrape all the ingredients of each product off of the photos that they took of the labels. And when the labels weren't available, we went to the website. So we have this huge database, over 6,000 products logged, 1,200 unique products. And, this is one of the most detailed assessments of product use, particularly from underrepresented populations. So one key area, because I think one thing I said I would talk about, well, what are emerging chemicals of concern? And one such class is formaldehyde releasing preservatives. And so this is from the paper that will be out tomorrow. So they're often used as preservatives, but these products will either degrade into formaldehyde or create formaldehyde once it mixes with water. So we used from another paper that had kind of compiled a list of 35 formaldehyde-releasing preservatives. And here are some of the example ones. And you can see, they're very complicated names and probably ones that you haven't seen before. And just a little thing about formaldehyde. So it is a known human carcinogen. It's also one of the most common allergens, and in the US, about 8 to 10% of people have a formaldehyde allergy, and much higher than, let's say, in Europe. It can also affect the respiratory system and other systems. But obviously, its carcinogenic potential is of high concern. And most other studies, there's been a lot of focus on formaldehyde and hair straighteners. So with the Brazilian blowout, there's also been attention to formaldehyde and nail care products and potential exposures in nail salon. But there's limited research on more frequently used products, especially those that you might use daily, not necessarily those you face in a salon. And just a little bit about the regulatory context. So formaldehyde is banned in personal care products in Japan and the EU. And these formaldehyde releasing preservatives have restricted use in the EU, and they actually have to have a label if they do have them, so consumers can know that these are in these products, and that formaldehyde may be a downstream kind of thing. Sorry. Okay. Wait. What else? Oh, sorry. What happened? Oh no. Okay. What happened? Sorry. Okay. In the U.S., there is action at the state level, and so that's very encouraging, and I can talk more about that. Okay, so we talked about that. Okay, so of our nearly 1,200 products, 43 contained FRPs, so any of those on that list. And the thing I really want you to highlight, I mean, or kind of, bring to the attention is these were really, really common in lotion. The thing about lotion is that it sits on your skin, right? So it's you don't wash it off, and you use it quite regularly, sometimes multiple times a day. So that was one big thing, is that it was very common in lotion. And of our nearly 70 participants, so over half of the participants used products with FRPs, and some used multiple. So I think 53% of our population used at least one product with FRPs. And you can see that, like one person used 3 products, right? And a couple used 2 products. And that this DMD hydantoin, sorry, I can't pronounce that, was the most common. And this is consistent with other studies we've seen. We only had one product that actually had formaldehyde, and I think that was an eyelash glue. So here is some of the alphabet soup of some of the common formaldehyde-releasing preservatives that we found. And remember, we didn't test products. These are things that are listed on the ingredient. So I just want to now move to, okay, so this is maybe disturbing, and you're all like, okay, what do I do? And how do I make change? So that's always where I like to kind of end the conversation or leave us, because I spend a lot of energy on this part, sort of connecting research to action. And I think about it at kind of different ways. So there's science-based advocacy, there's getting the message out, and then there's interventions, community-informed interventions. So one is, it's getting easier to find clean apps. So we know that there's certain brands that label and have filtering mechanisms to find clean products, right? So there's like Target Clean, for example. There's a range of apps. Skin Deep is one very common one. Clearia is another one that we've worked with, and that's nice because they have an app, but they also have like a thing you can download onto your web browser. So when you're shopping on Amazon, it will flag sort of if there's concerns with a certain product. Another thing is like collaborative efforts. So here is the Non-Toxic Black Beauty Project. You can see the URL. So I'm an advisor for this project. They have a ton of advisors. And so we kind of collectively came up with the criteria, and we really wanted to lift up Black-owned businesses that are making, kind of cleaner and healthier products. So there's a database you can search there. I will say, this is a very highly changing landscape. Products change all the time. Companies get bought out. So one of the challenges with using one of these things is it can be challenging to know to keep it updated, accurate, because the landscape is always changing. I think a lot of this is about raising awareness and talking about it. So events like this, I do a lot of outreach events with different community groups. And then, the policy is key. As I mentioned, California and Washington states are 2 of the states that have Washington State has the most health protective cosmetics legislation to date, and I testified. But many other states are proposing such legislation, and you could see they actually do target formaldehyde and chemicals that release formaldehyde in their list. And actually, just last month, they're now going through a process to decide kind of which formaldehyde releasing preservatives they're going to specifically regulate. They also have a whole part of their bill where they're doing kind of alternative assessment to try to find safer alternatives. And Dr. Robin Dotson, who's the first author on this paper, provided oral testimony, and our team, the Taking Stock team, also provided written testimony. So we are already, kind of translating this research into action. And then the last thing, I do a lot of media work, and both just to educate people about sort of what's in these products, but also shifting narratives sort of around responsibility and kind of these upstream solutions. And so I worked with Victoria St. Martin, who was at Inside Climate News, and we did a whole series of articles on this. So with that, I mean, hopefully, I'm pretty close to time. So I know that was a lot of information, but hopefully we have time now for a discussion, and I'll leave it up to Lee to kind of moderate that.
Thank you so much. That was amazing. And thanks for sharing the information about your new paper coming out tomorrow. So we're all very lucky about that. So I'll just start with some of the questions that came in ahead of time, and then one that's come in now. And that is, if you were going to use one of these apps, which one would you pick?
Yeah, that's a good question. So, I mean, so many of our participants in these studies and in these intervention studies, they just love Skin Deep because I think they find Skin Deep to be the most user friendly. And so, part of it is also like finding a tool that you're actually going to use. Of course, it's not perfect. So one thing about Skin Deep is, especially products kind of marketed, specifically to communities of color are just underrepresented in that database. But it seems to be a popular one. I think Cleria in some ways is providing, because their technology is better. Cleria's technology is better. You would likely get more robust information. So that's one that we do use. Think Dirty and some of the other ones. I know of them. I've had students compare them with, we have done a side-by-side comparison. I think each has kind of pros and cons because it's some of it is also about sort of what's in your database and how are you also integrate, like accounting for the fact that some chemicals just aren't that well studied. So, there's some kind of differences in the behind the methodology. So I think part of it is like also what user interface kind of speaks to you.
Yeah, so it can be quite personal. I liked the idea that you could have it integrated with Amazon. So
Yeah, I found that really helpful actually. Like my daughter really wanted a spray on sunscreen, and it's actually really hard because the aerosol aspect, right, introduces a lot of potential chemicals. So, you've probably heard about benzene and sunscreens, and most of those are with aerosol ones. So, yeah, so I use Cleria only to like do all this work. And then she's like, oh, I don't like that one. I don't like how it feels, right? So there's always that too.
Yeah, it is such a challenge to balance kind of convenience, comfort, even with sunscreen. I have a teenager as well, doesn't want the white look.
Right. Yes, exactly.
And so to your point of how we define both beauty and, I mean, even that is bundled in there because having the white sunscreen on your skin at the pool is not okay. And so it's very, very tricky. So one thing you noted was that in Europe, there are more regulations. And so if someone buys a European product in the US, can they feel comfortable that it is meeting the European standards? Do you know for imported?
I think it's a bit more complicated because I do know that some companies do have different formulations for different continents.
Okay.
Does that make sense? So I know that that is, that is a, so I wouldn't, I would still kind of look into it. I mean, I think if you bought it in Europe, that's another thing. But I'm not convinced, like I think, right, I think Unilever, at least I think it's based in Europe, but that doesn't mean that all the brands that Unilever own are, you know, like complying with only European regulations
Mhm.
for the market in the US. Does that make sense?
Yes.
Yeah. So I'm
Uh,
not sure that's the best assumption to make.
yeah. Okay. Super interesting. So another participant asked about what that they think that typical allergy tests don't include formaldehyde, and is there a way to identify whether someone has an allergy to formaldehyde? I don't know if you know about.
Yeah, I mean, I know that there is the skin prick test for formaldehyde, and I also think for formaldehyde releasers, and it's pretty interesting because it seems like the formaldehyde releaser literature actually, there's been more published on it in dermatology kind of journals than there are in environmental health journals. So it's actually a known. So I would say it's on their radar as for the dermatology field. And this DeGroot person who came up with the list of the 35 articles has actually also published in dermatology journals and has kind of they actually got interested in this because of the allergy issue and the contact dermatitis issue. So I would say it's known. What I don't know is what that means for like the place where you're getting your allergy testing, because that's so like localized in terms of like, what they test for, what they're knowledgeable about. But I would say that it's on the radar for the dermatology field because actually there's less about these FRPs in the environmental health literature, and more in the dermatology literature.
Fair.
And it's also interesting because there was a recent paper that did this ingredient scan of different chemical hair relaxers, also from the kind of perspective of thinking about allergens and scalp allergies, and some of the same chemicals that they looked for in that study were also some like these FRPs. So to the extent that it's helpful. So I mean, you could always go to your own, allergist or dermatologist and bring this up and maybe do a quick PubMed search, but I would say it is kind of in the lexicon of the field.
Yeah. Super helpful. So one of the questions is around seeing the slides, and I'll just mention that we will post the webinar on our website
Okay.
as long as that's okay. And we just for all the participants, we typically do a visual abstract after the webinar, and we'll work with Dr. Zota on that so that we can highlight kind of the critical points from the presentation.
And the formaldehyde, the new paper will be so it'll come out tomorrow, and it will be open source, so it will be freely available.
Perfect. And so maybe we'll also put it on our to-do list to make a visual abstract specifically about the paper as well.
Yeah, and I think there'll be one in the in the abstract, but I don't know. You can decide if it's helpful or if you want to do something else.
That's great. And we'll also post the link to the paper on the website.
And I know at least Washington Post is doing a study, but I mean, a report of it, or we'll be covering, like writing something. And I think, it will be getting at least some media attention.
Perfect. All right. So we had another question that is, what is harmful in triclosan? Um,
Triclosan.
yeah,
Triclosan.
and
Yeah.
it's used in hand soaps, I guess.
Yeah. Okay. So triclosan is an antimicrobial. It is an endocrine disruptor that has been shown to impact thyroid, among other things, but it is actually now has been phased out. So the FDA has actually phased out triclosan. Um, so I think it's a less of a concern now. And then the last thing it was left in was toothpaste. But I think like there was a loophole where it was allowed in certain Colgate toothpaste, but I think even that now has been phased out.
Um,
And I don't think it's banned, but it was a phase out.
Gotcha. Okay. I mean, there are just so many things that we are not
I
thinking.
know. Well, I mean, that's why, it's so much for individuals, right, to have to bear this burden. And, that's why I think trying to, whether it's through policy or, like, for example, like, you know, certain big box stores like Target does have a chemical policy. So, both Target and Walmart have their own chemical policies. So, that's another kind of way to simplify things. Is kind of finding certain brands. And what was I going to say? Yeah. And then, do simple things like just going fragrance free when, for a lot of these products. And we have another paper coming out, probably I mean, it's nearly accepted, but it was also in this taking stock study. And so, where we just looked at their kind of how they reported their kind of product selection preferences, like were there chemicals that they have routinely tried to avoid, and how that was correlated with the levels of chemicals in their bodies. And so and these are, it's like with adult women, with varying kind of educational and occupational backgrounds. And we did find that it was, it did make an impact. So we did see modest associations. And so I think the way we're framing it is that sort of this individual selection strategy is partially affected, but there's no way you can just shop your way out of this. And that there has to also be upstream solutions. But that paper will be coming out, probably in the next few months.
Okay, wow. I mean, that's pretty exciting that you can
Yeah.
see that. So,
Yeah, because like in other studies have sort of done more like doing interventions, which we're doing our own intervention study. But yeah, this was just sort of we had asked people like, do they avoid fragrances? Do they avoid phthalates? Do they like avoid parabens? And like how often? And so we are seeing some encouraging results.
yeah, super interesting. So, one of the questions that just popped up was how important is it to avoid these chemicals in everyday products because they seem to be in pretty much everything? And is the goal to just limit exposure or completely cut it out? And so I think you've already addressed a bit of that you do see that when people make choices to avoid some of them, it bears out in the testing that you've done of people's blood. Um, but what do we know about dose response or
Yeah, I mean, and the reality is that for all of these chemicals, there's other sources. So for phthalates, food is important. Your home furnishings and building materials can be important, right? Certain medical equipment, right? So, um, personal care products alone are not the only source. So, and then I think the other thing that, we always try to emphasize too is there are sort of certain critical windows of exposure, right? So pregnancy is one such time. Um, I do know people who are, now sort of in the space of like preconception counseling with couples who are trying to conceive and trying to kind of change their chemical exposures to see if that helps. I don't think the data's yet there, but so that's another kind of maybe critical window. And then obviously I think kids is big. Kids are important. I mean, obviously they're important, but their exposures are because everything's still developing, right? So, so those are some times when, I think that's another way to think about it is if, maybe there are times in your life where you want to be more concerted about the changes you make. And I think because life stage also impacts kind of your sensitivity to these chemicals in terms of health effects.
Yeah, so that's a really important point. So we think of that about kind of life course exposure and then these critical windows of susceptibility, childhood, adolescence, pregnancy, and then perhaps midlife, menopausal transition.
Right. Yeah. Yeah. Which has been studied a lot less. Yeah.
Yeah, yeah, exactly. And I'll mention here we have the SWAN study, the study of
Yes. Yeah. Yeah.
procrastination,
Yeah.
where there's a lot of really interesting environmental exposure across that menopausal transition going on right now. So
I've collaborated with Sun Kyun.
great, yeah.
Yeah, and I know him well, and we also we have a separate. I mean, sort of we have I'm part of a study with Project Viva where we're also studying sort of PFAS exposures, sort of across the reproductive life course and how that impacts sort of pregnancy to midlife health
Yeah,
in women.
that's amazing. And, we'll look forward to collaborating with you on My Cares, where, we're enrolling people who are between 18 and 49 and then following them and getting a blood sample at enrollment. And then we also have in Michigan a really amazing neonatal blood spot resource.
Are
And
you all asking about personal care products?
we are. So we have
Okay.
a pretty extensive personal care product. Part of our survey, we're not doing what you did, which is getting the pictures. So that would be a very, very interesting sub-study that we could consider. So that would be amazing to potentially use your app for that.
Yeah, it's a lot of, I mean, it's been it's been an investment and, we're excited to kind of publish more on the app data because I think there's a lot to learn. The other thing, another study we're doing actually specific around chemical hair relaxers is we have this case crossover study where we're actually collecting urine before, during, and after participants get a chemical hair relaxer and then following them through a chemical-free silk press and then back to a chemical hair relaxer to really understand kind of targeted and non-targeted exposures in a very controlled way.
Yeah, wow, that'll be super, super interesting. And so
Yeah.
conversation around the timing of exposures goes into a question that Lindsay put in about how does the age of consumers influence choices and education around this topic. Are interventions more effective in younger populations, and particularly when they're technology centered?
Yeah, I think that's a great question. I mean, we do educational sessions with adolescents. And so we have done those, and they're always well received. We've done them in English and in Spanish. We have done less around interventions specific to kids and adolescents. I mean, mainly also because it is a huge IRB hurdle to do interventions in kids, and right, because then you have, and it's very hard to work with the schools, very, very hard to work with the public schools in New York. So we just haven't yet tested any of that. I will tell you on the we do a lot of work with We Act for Environmental Justice. We did get this grant from the FDA where we did train the trainer programs for colorism and hazards and skin lighteners for hard to reach populations. So we worked with 3 community-based organizations like that served the South Asian population, the Dominican population, and the African immigrant population. And so, they even translated materials into different languages. And so that was once again, not for kids. It was, I think actually you had to be over 18, once again, partly because of human subject stuff. But was really well received. And so there we kind of did both addressing the colorism and the upstream drivers, as well as just the specifics around the, kind of, the fact that there's mercury and these skin lighteners. And in that case, New York, the city has done a lot of great surveillance. So identifying problematic, products and really trying to give them, some very tangible information. And they really enjoyed working with us on that. It was just a 1-year grant, but we would love to do more of that kind of work.
Wow. So another really interesting question is around facial moisturizers that contain SPF and daily use of that. So do you know whether there is any research to suggest that products with SPF are...
Yeah, so I think it would depend how it's achieving that SPS. That there are a set of chemicals called oxybenzines that are endocrine disruptors, that keep popping up on these kind of list of chemicals of concern. It is one that we report back on, these oxybenzines. So we do report back in this taking stock study. We kind of give them a summary of what we found in their urine, but we also give them a summary of their product scans, and oxybenzene. So I think it depends how it's achieving the SPF.
Yeah.
Does that make sense?
Totally. I mean, and these are questions that, as you mentioned in your talk, can be hard to get to because the answers of those, because you can't really necessarily get that off of a product list.
Yeah. I mean, I wonder, I think the oxybenzines might be listed.
We'll take a look at that. We're right now putting together a visual abstract about sunscreens.
Okay. Yeah, that would be helpful to know. Yeah.
Yeah, so everybody kind of watch for that in the near future, just as we're getting ready to go into summer.
And that's the kind of thing where the Clearia app would help you flag that.
Yeah, super. So we'll take a look at that app too and kind of test it out and maybe give out
Yeah, because the other thing you can do with the Clearia app, so there's the add-on like that we mentioned onto your browser, but then I think you can even upload a photo of your product, and it will, if it's in their database, it'll give you like an SM, like on text SMS, some kind of abbreviated report.
Okay, wow, that's amazing. Yeah, so we'll do some testing for everybody of using that app and give out our experience. So then let me I think we have one last question in the chat. Oh no, that was in the chat and the Q&A. So I think I have gotten to everybody's questions. A lot of, I don't know if you can see the chat, but a lot of people thanking you. And this was so helpful. And we'll try to put out some products for the community from it with visual abstracts and fact or fictions and so on, and send those to you to take a look. So thank you so much for doing the webinar today. And thanks to everybody who joined us.
Yes, thank you.